Hi, my name is David, and today we'll be going through a demo of the myDrugCosts tool. Typically, where you begin is you would go to the site set up specifically for your employer. That's typically your employer's name, and then you add .mydrugcosts.com. So if your company's name was, say, Acme, as an example, you would go to acme.mydrugcosts.com. However, if you can't find your employer's site, you can send us an email at support@mydrugcosts.com. Along with your employer's name, and we'll be happy to help you out. So once you're at your employer's site, what you would do is you go to create your myDrugCosts account, and you would enter your information in here, your first, last name, your email, zip, your password, and you confirm that along with checking the box to agreeing to the terms of use and privacy policy. And then you would create your account. Once you create your account, you're going to be asked to verify your account, and that is so that we know you are who you say you are. Because we will be showing you your prescription history. So we'll ask you to verify with some additional information. Just some common issues, just to get those out of the way, is note that if you are a brand new employee or if you have recently changed or enrolled in a new plan, sometimes it might take a few days before we receive that information. So it might be that we need to wait a bit until we have your information before we can confirm your account. The other thing is, your zip code. Make sure that you use the zip code that's the same as the one that your insurance company has on file with you. Typically, most of the verification issues come as a result of either one of those two cases. Either you're a new employee or you enrolled in a new plan, or it's a zip code for an old address that you might have lived at that you never updated with your insurance company. So as long as those things are correct, typically we shouldn't see any verification issues. Now, to log in, I've already got my account set up, so I'm just going to log in here. And typically where you will begin is on the tab called My Prescriptions. And what My Prescriptions does is it shows you any claims that you filled in the last 6 months or 180 days. And so here we can see in this example, I'm taking two medications, levothyroxine and esomeprazole. And we can see the name of the drug, the strength in the form, the quantity, as well as when I filled my prescription, how many days I have remaining on my fill, what I paid for it versus what my employer paid for it. So in this example of levothyroxine, I paid my $20 copay, and that was the total cost of the drug, so my employer didn't pay anything. However, with esomeprazole here, we can see that I paid my $20 copay, and my employer paid the remaining amount of $68.90. Total drug cost $88.90. I paid my $20, and my employer pays the remaining amount. We'll also show you what pharmacy I acquired my medication at or filled it out. And then the great thing is, if we're able to find a cheaper way for you to get your medication, we'll show that here in the green action button here. And so here we can see, as an example, with esomeprazole, since I only have 6 days remaining on my prescription, I need to fill this pretty soon. So I'll click on this button where I can save $6 on my next fill, and we can see that I've got one savings opportunity, and that's by using a discount card. So here we can see the list of pharmacies in terms of increasing cost that I can use a discount card at, and what my cost will be at that pharmacy. So starting off here with Food Lion, we see that I can pay as little as $13.96, which would save me the $6 versus paying my $20 copay using my insurance. And if I'm not sure where that pharmacy is, I can click on the button here and see that here's the Food Lion pharmacy. If I'm not sure how to get there, I can set up turn-by-turn directions, and I can do this directly from my smartphone or my PC, and I can get turn-by-turn directions on how to get there. If I want to make sure I get there before they close, I can see their hours of operation, or I can even call them directly from my smartphone here. Maybe I want to make sure that they've got inventory of the drug before I make the trek out to the pharmacy. And so all of that's available from within the tool. And all I would need to do is show them this card. So I can do this directly from my smartphone, or I can email or print it out. But as long as I provide the pharmacist with this information, these member ID and group ID codes, as well as my RxBin and PCN codes here, I should be able to get this medication for $13.96 from the Food Lion pharmacy here. So This is great because not only does it give you the ability to save money, why pay $20 when you can pay less than $14? But there's another great thing in this, in that your company would also save money. When you buy using a discount card, you are not using your insurance, and so the money here that your employer would need to pay of $68.90, now that goes away too. It's a win-win for both you and your employer, and so it's just one of the good things here, that capability like this, so great, not just for the employees, but for your employer as well. Here we see with levothyroxine, we can save as much as $16 on our next fill. And if we click on that, we can see that there are two savings opportunities. One using a discount card, and we talked about the discount card approach before, and we could save $6.10 here. Or we could use a $4 generic program. And a $4 generic program, not all the medications will be available for $4. That's the name for this type of program. Think of it as a discount program at a pharmacy. And so here we can see there's two of these $4 programs, one at Walmart and one at Walgreens. The Walgreens one costs, there's a membership involved, but the Walmart one, there is no membership fees involved, and you can literally walk in with your prescription and walk out the door with it filled for just $4. And so again, just a great solution here, because we can see there are multiple Walmarts that will offer this at $4. You can see a map, and you can see the locations of where those Walmarts are. Again, we're not promoting any individual drugstore or pharmacy. This is really just the benefit. We're going to show you all the ways you can buy it, present to you what we believe is the cheapest way of acquiring your medications. Now, that's for prescriptions you're taking, but what happens when you're meeting with your doctor and your doctor actually prescribes you a new medication? Well, here we would go to the drug search feature. And so typically this is where we would start. And I'll walk through a few different use cases that we help counsel members on. And so if you start off with, any drug, and we'll start off with a drug like Bistolic here as an example. And this is really low-hanging fruit, but it's one that surprisingly we find that a lot of employees just are completely unaware of, and that is when you look at a drug like Bistolic. So in this example, Bistolic is a Tier 2 drug on the formulary, meaning it's a brand drug, but it's a preferred brand drug. So it's offered at a $60 copay, which is a moderate cost for a lot of individuals. And so we see that there are no cheaper ways to buy this without insurance. So $60 may be your best bet, but there's still a great opportunity for you to save your costs on this prescription. And that's if we look at the different months of supply. So here with Bistolic, we can see, if there's different forms, you can check that out. You can change the strength, you can change the quantity. But if we just look at changing the months of supply from 1 month to 3 months, so at 1 month, our cost was a $60 copay. However, you can see that if we were to go to an in-store pharmacy and get a 3-month supply, whether 3-month supply is available from a retail pharmacy or not, you would still typically pay $180. So whether you go once every 3 months, or if you went 3 times once per month, that would cost you $180. But if you were to switch over to mail order, it would only cost you $120. So you would basically be paying 2 months and get 1 month free. So that's a 33% reduction in cost. So while this is low-hanging fruit, it's one that we're constantly surprised by the number of employees and members that are just unaware that this is an opportunity for them to save. Now, let's look at some other use cases. So you may take, a drug like Nexium, and with Nexium, if you've got ulcers or GERD, we can see it's a brand drug, and there is a generic available. But we see that with the brand drug, there is no coverage for this drug, right? So your insurance doesn't cover this. Now, this is typically not a problem because there is a generic available that we saw earlier, esomeprazole, in my prescriptions. In fact, here, let me switch over to the capsule version because that's the one that's most commonly prescribed. So it's not covered. Now, this is, again, normally not a problem, but if your doctor indicated that this was dispensed as written, or if you really wanted to take the brand instead of the generic, it's not going to be covered by your insurance. So, the great thing here is that we do have an option available with generic Nexium or esomeprazole. And so that's, one easy way of solving that. Now, when we look at this, however, we can find another, multiple examples where you can have a brand drug that doesn't have any generics available, like a drug like Tradjenta, which is a commonly prescribed medication for type 2 diabetes. In this example, there is no alternative, meaning it's not covered and there are no generics available. So in this situation, what do we do, right? Because if your doctor prescribes you a drug like Tradjenta, it's a very expensive drug, about $500 a month in total cost. And that's something that, no individual would like to pay. What we don't want to see is where an individual feels like, okay, this is what my doctor prescribed me and I can't afford it, so I'm just not going to take anything, right? And then their health suffers, and that's not a situation or a scenario that we ever want to see. We have a feature called Switch to a Similar Drug, and what Switch to a Similar Drug allows is it will show you all of the other medications that are in the same drug class, in the same therapeutic drug class used to treat the same exact condition. And so now you can review this list with your physician, and your physician can say, well, you know what? Januvia is a great alternative. We'll put you out on Januvia, and we'll see if your condition continues to improve. And if so, great, we'll keep you on it. And if not, we'll find something else for you, right? And so all of this does is it helps find options for you. Current alternative is cost prohibitive, right? We want to make sure that people are finding cost-effective treatments for themselves that their doctor and their physician is in agreement with. What we don't want to see is people whose health suffers as a result of not being able to afford their medications. And so we can see with Januvia, still a pricey drug at $60 copay, but certainly much better than paying $500 if the medication was not covered. And again, if we look at further lowering our costs, we can switch to the 3-month supply and get that for $120 as opposed to the $180 if you were typically going into the local pharmacy to get that once a month over a 3-month period. These are some examples. We've looked at ways to buy, with insurance, either switching to mail order or looking at retail 30 supplies. We've looked at some of the ways to buy without insurance using, a discount card or a $4 generic. But I'll also give an example here on other ways that you can save by buying off plan. And so we take a drug like lisinopril, which is, maybe the most commonly prescribed medication for blood pressure. And here we can see that on this example, it's a $20 copay, but we can look at ways to buy without insurance. And we talked about, buying it using a discount card or using a $4 generic program. And again, we'll show you multiple different options in which you can make the final call on which way that you'd like to buy it. But we're just going to show you the data that shows you all the different ways that you can lower your costs. Now, one of the great things here is we partner with a nonprofit pharmacy called RX Outreach, and they are an amazing group to work with. What they do is they offer deeply discounted medications to individuals that are under certain income levels. And you can see what some of those income levels look like right now. So, you could be a single person making less than $51,000 a year, or say you're a single parent with 2 children making less than $86,000 a year. You can qualify for RX Outreach pricing. One of the great things, at least for 2021, is due to the pandemic that is impacting the country, they have agreed to waive these income levels for anyone who is undergoing hardships as a result of the pandemic. There is no income verification. It's all based on a system of trust. So if you are undergoing any hardships as a result of the pandemic, you can basically qualify for RX Outreach. They don't cover every medication that's available, but they cover the vast majority of most commonly prescribed medications. And again, we're very proud to partner with them, and we're very appreciative of the service that they provide, especially to individuals that are income constrained. That's the primary use cases captured in a nutshell. There are other areas of the tool that are available, things like myDrugList, which allows you to create a list of medications. You can create a new list. Say your kids are going off to summer camp and you want to create a list of their medications. Based on the list of drugs that you create, you can do things like set up and get a view of budget estimates for what your costs might be over a full year or monthly based on those medications, as well as a tool that you can use during open enrollment that will help compare what your costs might be on the different plans that are available to you through your employer, that can show you what those costs will be. That's pretty much it in a nutshell. We have a notifications feature that will alert you to anything that we feel is relevant to your plan, whether it's generic policies or wellness programs or anything that your employer would like to promote through us. We're happy to do that. We'll also include a copy of your summary benefits that's available to you at your fingertips at any point in time. So that's the tool in a nutshell. Again, if you have any questions, feel free to reach out to us. You can contact us at support@mydrugcosts.com, and hope you have a great day.